This morning, the Canadian Medical Association is calling for more transparency about the distribution of personal protective equipment. A new poll just out in the past hour says this: greater access to that equipment would reduce anxiety for 88% of physicians. 88%. Dr. Sandy Buckman is the president of the Canadian Medical Association. He joins me now from Toronto. Good to chat with you this morning. Let's start with your call for transparency about how PPE is currently distributed. What needs to change?
Well, one of the reasons for anxiety that we're learning is that physicians want to know when their PPE is coming. Right now, there's just an additional level of anxiety because we don't know what's coming down the pipes. We haven't received clear information about who's getting PPE, when it will arrive. So that's a big challenge. And so we need clear, transparent information. We need regional health authorities need to know where the PPE is going so they can deploy it properly. So that's additional anxiety on top of everything they're facing with COVID-19.
The poll also found 84% of doctors say more testing would also help ease their anxiety. So what's holding up the widespread testing?
Well, it's a good question. I think Public Health Agency of Canada has done an incredible job, but they're using the information that they're getting in the best way they can. And looking back, we can say, yeah, maybe we should have started testing a little bit earlier. But we now know we need evidence. We need the evidence from testing in order to be able to plan reopening of our hospitals, of our medical system, of the economy. We need the best information we can, and that's becoming pretty clear. So not having that information is, again, leading to a lot of anxiety for physicians and other frontline healthcare workers.
I also want to talk about supply. So about a third of doctors in community practices who were polled said they had less than a 2-day supply of face shields, goggles or glasses, respirator masks or gowns. How are they managing with that?
Well, they're right on the edge. And again, that's another reason for the high levels of stress and anxiety. You know, they're searching everywhere they can. We did a poll at the end of March and found that only 15% were receiving any confirmation of the supplies that they ordered from all their usual suppliers, even trying to get it on Amazon. So that's the issue. We need to know when it's coming and that we'll have sufficient supply. And other physicians, particularly we are hearing from Alberta, are talking about a substandard supply that they're getting. So again, one reason on top of another for increasing stress and worry.
And let's talk specifically about anxiety of those working on the front lines, including our doctors. This poll showed 74% of doctors are somewhat or very anxious about this pandemic, and only 26% are reporting low anxiety levels. Talk to me about anxiety and what our doctors are feeling.
Well, again, they're feeling the anxiety because they're afraid about being put in harm's way for their health, for their patients' health, and for the health of their loved ones. You know, this is a contagious disease that they can take home with them. You know, as a rule, when we put ourselves on the front line, when we put ourselves in danger, it's really just about us individually. We would never expect a firefighter to go into a burning building without adequate equipment to protect him or her. So they're having this additional level of anxiety that they have to be put in harm's way, infecting themselves, others, and their loved ones without adequate PPE. So it's a huge level of stress for them. And in addition, they're already overworked. We have a history of burnout that is hard. But
Dr. Sandy Buckman, I have to stop you. Thank you.
Okay.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.